Green.
Green.
we're 3:02 and we'll get our meeting started for Monday, April 9. Welcome everyone to the Human Rights Commission meeting for the City of Palm Springs. First up is the mission statement. Who hasn't done the mission statement for a while? Mr. Gross, Commissioner Gross. You've never done it?
Never done it. I'm still an HRC virgin.
Oh, well, excellent. Will you please read the mission statement for us?
I'll see what I can do. Let me get my wording, do the mic.
Remember, don't move the mics.
Well, I did move it away from me a little bit before, so I want to be sure. Okay. Yeah, sounds like I'm doing well with that. Okay, our mission statement. The mission of the Palm Springs Human Rights Commission is to promote and protect the diversity of our community and to improve human relations through education and community awareness.
Thank you very much. Now we'll have roll call.
Chandrasena,
Present.
Chappelle,
Here.
Serrano,
Here.
DeHart,
Present.
Gross, Morgan,
Present.
Randolph. Present. And will you introduce the...
Yes, we have a new commissioner who is sworn in, and he's going to introduce himself in a little bit, but for roll call purposes, Ryan Michio is the newest commissioner.
Also present.
And he's present.
Thank you.
We'll go right into public comments. Any person who wishes to speak on a topic within the city's jurisdiction during this portion of the agenda must file a speaker's card with the staff liaison before that portion of the agenda is called. 3 minutes are allocated per speaker. Although the commission values your comments pursuant to the Brown Act, it generally cannot take any action on items not listed on the posted agenda. Commissioners will not enter into discussion with speakers, but during commission comments may refer the matter to staff for report and recommendation at a future commission meeting. And we have cards for 2 speakers. First we have Tamika, and then Robert will come up next. So Tamika, if you please come up and introduce yourself.
Good afternoon, and thank you guys for having me. My name is, you guys have a lot of new commissioners, so I'll introduce myself. My name is Tamika Foots-Rochelle. I'm the regional manager for the State Council on Developmental Disabilities. That's the state of California. I actually cover Riverside County, San Bernardino County, Inyo County, and Mono County. So that's most of Southern California up the backbone going toward Reno. I just wanted to make you guys aware that on March 8th, 2018, that Governor Brown actually established a select committee in regards to addressing systemic issues for people with intellectual and developmental disabilities. Your representatives for this county would be Chad Mays for this direct area, as well as some portions of Riverside County going more toward Moreno Valley and Paris would be Assembly Member Jose Medina. I've already met with Mr. Medina in terms of providing them technical assistance, but I wanted to make you guys aware so that if there are opportunities for the HRC to get involved in issues or events or things like that for this area, you guys can be included as well. Commissioner Chandrasena is actually a member of my regional advisory committee. We also have some upcoming trainings and events, which I will go ahead and I will share with you for people with disabilities. I collaborate with various stakeholders, Department of Rehab, Disability Rights of California is my federal partner, Braille Institute, and other stakeholders in the community, because disabilities touches all aspects. Homelessness, as I see on your agenda, is something that I'm heavily involved in as well. So if you guys need any technical assistance in regarding the impacts to people with disabilities, by all means, you can reach out to me directly or any of my staff. We can also provide you that assistance as well. And that's all I wanted to provide you today.
Excellent, thank you. And next, Robert Heinbaugh to speak with us.
Cool. Thank you. Good afternoon. My name is Robert Heinbaugh, and I'm a resident here in Palm Springs. Last month, my husband and I spoke with you about the tobacco retail license, County Ordinance 838.1. And Palm Springs has a retail, the distinction of being selling tobacco to minors that's 3 times the rate of the national average. And we're talking about, in the mission statement for the city, enhancing the quality of life for our current and future generations. And I think this is an issue that we need to be addressing as a human rights thing. And now I'm speaking tongue-in-cheek when we say your mission statement says to protect the diversity of our community. Well, the diversity is not to be promoting the sale of illegal tobacco to our minors. And with that in mind, I think what we need to do is to take a step forward and protect the students today, the minors today, who are the object of the tobacco industry, and stop this illegal behavior that's taking place. With that in mind, I would like to tell you some of the steps that we've been taking with moving the tobacco retail license forward. We're working with the Ecology Committee of 1PS. We've also we have addressed the Sustainability Commission and working with their wellness committee, the wellness subcommittee. The Sustainability Commission has a wellness committee, and we're working with that subcommittee. And what we would like to do is to see if you would, number one, give us a designated commissioner who might be willing to work with us to move this forward within your commission. And also, we're asking you to give us a letter of support to help move this forward so that we could eventually get it through the city council. We're one of 4 cities in the Coachella Valley that have not passed this tobacco retail permit. And it's a disgrace on the city, particularly as we're trying to move forward and be that unique city and to protect our youth in the future. With that in mind, I have no further comments to make to you, but to urge you to take a look at this and help us move this forward to protect the current and future generations of our city. Thank you so much for your time.
Perfect. Thank you. No other cards have been submitted, so we'll go to Commissioner, staff, and student comments. And to start off, I'll ask Ryan to please introduce himself and share a little bit about his background with us.
Sure. Well, good afternoon, everybody. A little bit about me. I've moved here to Palm Springs just about a year ago. After kind of a lifetime of traveling here and vacationing here, I decided I wanted to give up my previous cold climate in Chicago and come out here for sunnier days. And I have a more immediate background in corporate diversity and inclusion work. And so as I was getting to know the city in Palm Springs, I wanted to be more connected and involved here in the city. And through some neighbors, learned about the various commissions and boards here, and I thought that this one would make sense given some of my previous work. So a lot of what the commission is charged with, as far as I understand, I have some background and experience doing on behalf of a large Fortune 75 global company. So I hope to share some of my experiences and learn from yours as well and contribute to the success of the commission here. So pleasure to be here, and thank you for welcoming me with open arms.
Excellent. And whoops. Welcome. And just in the last few moments, we had another commissioner sworn in who's going to join us at the table. So Terry, please come on up. Literally, she was just sworn in just minutes ago. Welcome.
Thank you so much.
And maybe if you can speak into that microphone, just do the same thing, introduce yourself and share a little bit of background.
It's mobile. Good afternoon. My name is Terry Andrade, and I have been a resident of Palm Springs for 12 years full-time and another probably 6 or 7 part-time prior to that. I retired from the city of Ventura as the deputy director for the Housing Authority. My background is in housing and homeless issues. I'm on the Well in the Desert Board and also on the city's task force for homelessness. So I look forward to working with you folks. I'm interested in this commission and what you do, and look forward to being a part of it.
Well, welcome.
Thank you.
Commissioner Morgan, any comments?
No, not at this time.
Let's work our way around.
Yes, a big thank you for the folks who assisted at the 1PS picnic. I guess this is both my 1PS report and also just a comment to thank all of you who were there. I thought we had a good showing. We got a good number of survey responses. And there was, at least I was there until 1, and we had a lot of interest at the table. So I appreciate the commissioners that supported us at the picnic.
Commissioner Randolph.
I would like to suggest that we put the smoking ban or smoking issue in Palm Springs on the agenda for next meeting.
Okay, we'll do that at the end of the meeting at
Okay.
number 8, I think.
Okay.
No, thanks.
No comment at this time, but I will have something more to say later on.
The picnic was a very busy day. There was a lot of interest at the table. We hadn't had a survey available before, and I thought that was a very good way to get interest and to tell people that we're here, because I think that people still are not always aware that we're here. So it was good. Thank you.
Excellent. And I just want to acknowledge the students that organized the March for Our Lives event on the 24th of March. One of the most moving and powerful gatherings that I've witnessed in my time here in Palm Springs. So hats off to them, and I'll bring it up at a future point where we might be able to do something to recognize the student organizers. Okay. Did I skip something for you? No? Okay, sorry. All right, so next we've got, in our continuing our effort to bring local community experts to the table and share background with us on senior issues and issues related to aging in our community. We've invited key stakeholders to provide a top-level briefing that examines the primary facets and challenges impacting seniors in Palm Springs. And with us today from the Riverside County Office on Aging is Stephen Guest. Stephen, welcome. Geist. Welcome, and thank you for joining us today.
Thank you. I have some handouts to share with you, and these are predominantly excerpts from our area study. And the Office on Aging is obligated to our state agency to provide them with an area plan that covers 4 years, and every year we do an update of that plan. And if I can, I'll just pass over. This is for the chair. That is the complete study. I didn't want to bore you with all of that detail, and if I put it on the table for you. If you are interested in more information and demographics and some of the studies that go behind our conclusions, then you can see that on our website. The website is on the brochure I handed out, rcaging.org, and the complete publication is there. So I want to thank the commission, thank Commissioner DeHart for inviting me, and I don't know that I can tout myself as the expert. I've been with the Office on Aging now for 8 years. I was, prior to that, working with the Alzheimer's Association as the regional director for another 7 years. So I've been in the desert working with this population for quite some time. To start out with, just to give you an idea of one of the overarching issues that I think we're going to be facing, and that has to do with our population growth. That as the baby boomers are aging, we are seeing an increasing older population and a decrease or a minimum of younger generation who will be providing the workforce for all of us as we age. The total population, this is a projection from 2010 to 2060, and the total population for the Coachella Valley is is suggested that it will increase by 68%. Of that population, those aged 65 to 74, you're going to see a 175% increase. Those 75 to 84, you're going to see a 240% increase. And those over the age of 85, you're going to see a 443% increase. These are astounding numbers when you look at the amount of care that our oldest population is going to require. Do we have the facilities to care for them? And as I said before, do we have the workforce to care for them? And what are going to be the implications of that? Currently, the primary mission of the Office on Aging is to provide services and support to keep people living independently as long as possible in their own homes. If we don't have a workforce that can provide the home care for them, they're not going to be able to stay in their own homes. So are we looking at more institutionalized older adults? And if so, do we have the facilities to accommodate that? On top of just the aging issue, 75% of people 65 and over, and that includes me, have one or more chronic condition. So we're talking about health care requirements. And it could be something as simple as hypertension or diabetes, but all of those still require medical attention to keep them in control. Then the other piece of the puzzle is the poverty level. That again, as our population ages, we find that their resources diminish. We didn't necessarily plan on a retirement that was going to last us 30 to 40 years. So we don't always have the resources to be able to last that long. We have the lost my train of thought there, but the poverty, the federal poverty levels, we've got 49% of all adults over 65 do not have enough income to meet their basic needs of housing and food and medication. The current federal poverty level for a single person is $12,000, but we're looking at a population that is at or below our poverty level. That doesn't take into account all of the expenses that one can anticipate for an older adult, like their health costs, housing, transportation, all of those. So there was an index that was created called the Elder Economic Security Standard Index, or the Elder Index. And I don't know if you've heard of that, but it's trying to put cost of living in a fuller perspective. And if you look at that index, 33% of seniors in Riverside County fall into an eligibility gap. And that eligibility gap means they don't have an income that would qualify them for services or benefit, but they also don't have enough money to meet their needs, or that elder index number. And that's, there's more explanation of that in one of the handouts that I gave you on the income, and it's on page 42 in that excerpt. And it just shows you where the level of the elder index is, and that's the 2013 number. Elder index is updated every 2 years, so the 2015 numbers just came out, and there's not a lot of variation between that and the 2013. But it just shows you an illustration of that, what that gap is, based on what the income levels are of our older adults, and what that affords them, and what they're lacking. And it's significant numbers. So poverty is going to impact primarily your housing and your nutrition. And data that is in the plan is gathered not only from studies, but is primary data taken from surveys that are collected throughout Riverside County, and also focus groups that are done, much like your listening sessions that you're doing here. And interestingly, the largest collection came from the Palm Springs, Cathedral City, Desert Hot Springs service area, which is where we divide up the county into those areas. And part of that is because we do a survey collection campaign at Pride and collect a huge number of surveys from our LGBTQ community. And if you look in the needs assessment section of the handouts that I gave you, and look on page 73, you'll see the results specific to the LGBTQ community. And you'll see that they're talking about their physical health needs, obviously discrimination, sexism, and ageism. But then they get into mental health, the isolation issues, and alcohol and drug abuse. So we've got mental health issues and socialization issues. And then you get into things like the employment and housing. As the poverty level is experienced, people don't have a lot of options if you're an older adult. People aren't clamoring to have you re-enter the workforce because of ageism and disability. And so trying to work out solutions for our older population that are homeless or at risk of homeless are not as viable. So if you talk about nutrition, I'm trying to be mindful of time here, so if you look at page 70 in that section of needs assessment, it brings up the HARC analysis of nutrition insecurities, especially for our older adults. So approximately 4.1% of older adults are food insecure, and they take reduced size meals to compensate for being able to cover their housing cost. We do know anecdotally, if not statistically, that they're also not getting their medications because they can't afford to buy their medications. So the issues just compound upon each other. But you'll see there the HARC analysis. I don't need to read to you about that stuff. But just to say that Office on Aging and some of our local senior centers are trying to address nutrition issues by providing them congregate meals as well as home-delivered meals. The challenge to that at this point is we have an administration, these are federal dollars that support this, and we have an administration that is determined to reduce human services budget, and we are seeing that already, or the Office on Aging has already experienced that in across the board kinds of cuts that we are dealing with now. So right now in the Coachella Valley, we've got a crisis where we are not able to take new clients for our congregate meals for the end of this fiscal year, meaning through the end of June. So I'm out on the street begging and borrowing and going for grant money to try and get as much relief from that as we can. Across from that, if I back up just one step here, the survey results, you'll see there the listing of the overall population. We went through the LGBTQ results, but that's for the overall population. The number one answer is transportation, and you'll hear that from almost every speaker that you have representing the older population, well, any population, is we just don't have adequate transportation. And you're having a population that is more dependent on transportation services because they're not driving themselves or they don't have vehicles. And we've lost things like the Desert Health Car have gone away. We don't have services to get people to their medical appointments. So that's a burning issue, obviously. They're looking for physical activities and socialization. We've beefed that up in our senior centers. I don't know if you've heard of Fit After 50. It's a low-impact exercise program. We've now got Walk with Ease. Zumba Gold is catching on all over. So there are programs that are being introduced, but it always comes down to a matter of support funds for some of those. And then you see the nutrition and things that I've already mentioned. Caregiving is another big issue. And again, as we look at, and pull me off if, okay. Caregiving is a huge issue. If we look at the workforce diminishing, it's going to be a dependence on families to do the caregiving. And that's fraught with its own issues. If you've been a family caregiver, you know the pressures of that on yourself. We see, when I was with the Alzheimer's Association, that our caregivers often predeceased the person that they were caring for because they don't do self-care. The pressure and stress gets to them. And so we do have support services for that, and you'll see several Alzheimer's, and UPC has services, but several nonprofits provide support. We just need to encourage people to take advantage of that, and they're going to become more reliant on those kinds of things, and that's going to impact the workforce as well. It's tough to be juggling between being a caregiver and trying to maintain your job and your career. I think it's going to be even more acute for our LGBTQ community because oftentimes there is not immediate family who can provide that care. There's going to have to be alternatives for that population. And we also see, in terms of facilities, we've got one facility here that's addressing the LGBT community, but we have a long way to go in educating and doing more cultural sensitivity with our existing facilities, that there are specific needs for that community. And we've seen the effects of ageism and sexism and homophobia. See, the homelessness issue, I'm not going to spend a lot of time addressing that because if you, I think you said JFS is going to be coming, or they've been here, Jewish Family Services.
Yeah, we've got a subcommittee on that also.
Okay, right.
JFS is going to be next month.
Right. Because there is also a senior collaborative that meets, that came out of the Clinton Health Initiative. And our priority right now is looking at homelessness for particularly the older population. Because that's the largest growing population of homelessness. Then the other major issue that I'll end with is elder justice issues. And for elder justice, that priority is looking at elder abuse and prevention of elder abuse, educating our population about what is abuse, and getting the community and individuals empowered to be able to report it. A lot of our seniors are victims and they are embarrassed to be victims or don't understand that they're being a victim, and so they're not reporting and we're not able to help them. But it's important as a community at large that we start doing something to make that awareness more acute, give them the opportunities to report safely and to apply not to point fingers, but do some sensitivity training with our law enforcement as well, that they can try and respond to either situations or reports in a more friendly fashion, a more sensitive fashion. So I think I'll let the rest of it is there. One thing that I will, because it's not highlighted in there, one of my first duties with the Office on Aging was to manage our Grandparents Raising Grandchildren program. That's a hidden population. It's a growing population. 1 in 10 children in this county is being raised by a grandparent, and there are no services to support them, either the kids or the grandparents. And talk about caregiver stress, you're talking about, imagine, I can't imagine myself doing this, taking in a 3-year-old to raise full-time again. It's nice to be able to send them home with their parents. But they're doing that for multiple grandkids all arriving at a single moment. So looking for some ways that we can support that population particularly.
Excellent. Questions from the commissioners? Anybody have questions? Commissioner Gross?
Yeah, one thing that's become top of mind for me when I think about this whole area of elder abuse, and I didn't hear you mention, although I think you got close to it, and it's this. First of all, the availability or lack of availability of senior guardians, and also elder abuse in guardianship programs. I am aware, unfortunately, of some very severe abuse. I'm hoping they're isolated cases, but I'm wondering if you could speak to that for a moment, because that, to me, particularly in some of the points you mentioned about folks who are aging without family, without support systems, quite frankly, are quote-unquote alone in the world, it's a significant issue.
And it's, as far as public guardianship, you're right, it's grossly undermanned, understaffed, and both trying to accomplish an investigation and to appoint a guardian, a public guardian, is taking an inordinate amount of time. In that process, however, Adult Protective Services is usually involved to try and do that interim support piece of it. But oftentimes the abusers are family members. And the abusers, the family members are taking guardianship or taking the rights of the older adult away by getting premature guardianship. And part of that is, again, educating our seniors and empowering our seniors to take their lives under their own control. And to report. If it doesn't smell right, it's not right. And so yes, I know of instances where guardians have been appointed who have become the abusers. And the only way we can catch those folks is by, again, reporting. The guardians are required to provide a yearly or annual report, but again, we don't have staff, and that's not my office, but there's not enough staff to follow up on all those reports to say, oh yeah, that's right, that's not right. So again, it comes down to staffing and money. But you're right, it's an issue that's out there, and we're sensitive to it. And again, it's going to take all of us to keep our eyes open to prevent that.
Other questions? Yeah.
Probably along the same lines, but what about, thank you. I'm thinking about facility abuse, like actually in a facility where you hear so many horror stories about people. Is there like an ombudsman program or something of that nature that tracks those complaints or responds to those complaints or determines if they have any credibility?
Yes, the Ombudsman Program is actually service contracted by the Office on Aging, state funded. That's one of the few offices that has gotten an increase in funding. Yay. But they are required to respond to any complaint that they receive, and they have to do that within a prescribed amount of time. And they have to do an investigation of that. There is a group in the county that's called the CARE Team, which is the Curtailing Abuse of Older People. They made the words fit the acronym. But, and it's a multidisciplinary team of code enforcement, of licensing, of adult protective services, of the sheriff's office, of the DA's office, and they work pretty much as a team. So we meet on a monthly basis, and facilities that are being reported to licensing and are being investigated, that's brought to everybody's attention, so that if we know of any situations or we suspect any situations involved in that, that can become a part of that investigation. They don't always make the news reports, but there is a board and care. It's actually a set of 3, and we've got a provider who's running those things. She was finally tracked down. Her licensing is gone, but she still, you can run a board and care out of a private home, and she still is finding clients and taking advantage of them. So she's now being looked at for criminal prosecution. So we're very actively looking at those. It's harder with the larger facilities, and again, it's a lot of that is educating, letting families and the team, the staff in those facilities know that they have a right and they have a responsibility to report what they see, because everybody in that facility is a mandated reporter, and their jobs depend on their following through with those things.
Thank you.
So is that ombudsman specifically for facility issues?
The ombudsman is facility issues, correct. And then APS comes in if it's a home-based issue. And elder abuse is not just physical abuse. Most of what you see here is financial abuse. And it comes from family members, it comes from professional staff, it comes from best friends of the family, you know, your hairdresser who becomes your good friend and starts taking advantage of you. So there's all forms of abuse, just the isolation. We've seen situations where seniors are being basically prisoners in their own home because the caregiver doesn't want them to see or speak to anybody. So those are the hard ones to get to, but it takes, like I said, community education is a primary.
Is there another ombudsman that handles issues that are non-facility related?
Like I said, that's mostly the APS.
Mm-hmm.
But I encourage anybody, if you suspect something or you want an investigation of something, call the Office on Aging. Mm-hmm. We're your go-to for senior services. And if you call the 800 number, we have a group of HelpLink workers who are all trained resource people who will do a mini assessment and find out what the specific issues are. And we'll do the referral to services, whether it's our services or community services that we're aware of, and get them hooked up. And we never just want to just give out a number and let you go find your help. We're there to help you find and connect with the services that you need.
So you mentioned that there's the growing gap in aging boomers and the younger workforce. So where does the Office of Aging see your priorities changing in 5-6 years down the road to be addressing that core issue?
Well, we are already starting that process in terms of trying to educate the workforce or get a trained workforce. There are very few graduate programs in gerontology. And it's not one of those warm and fuzzy fields that people are flocking to because it's not lucrative to have to spend more time with an older person in a medical exam or an appointment than cranking people through otherwise. But we've just started a program at the Office on Aging with internship programs and licensing programs so that we can get a trained gerontological workforce and to try and motivate people to enter that field so that they understand, you know, this is the specific population that's going to need your services. Mm-hmm. So it's baby steps, but apart from maybe it's robotics in the future, I don't know. We don't have the crystal ball. But as I said in my opening remarks, we may have to switch our goals in terms of long-term care, that it may not be that we've got the resources to try and keep people living independently. So if that's going to happen, how do we create environments for long-term care that are going to be more satisfactory and promote that kind of longevity and healthy living that we would like to see? So hopefully we will see an increase in the quality of care provided.
And last question on the 33% gap of the people who don't qualify for services. How do you handle those folks in that 33% gap? How do you refer them to, or where do you refer them?
It requires a lot of creativity and multiple agencies. Like I say, if that gap is causing a risk for homelessness, then we are putting together our coalitions on how do we provide services to prevent that risk or ameliorate that risk of homelessness. For nutrition services, again, if the federal dollars are not going to be there, it's going to require putting together. We are looking more at partnerships, how community partnerships can be built and strengthened so that we can do those services more efficiently, more effectively, and do it collectively. For instance, the senior collaborative that I talked about, with a lot of our nonprofits and public agencies, you have dollars that are given to you from a budget that say, this is how it has to be spent, and these are the eligibility standards for that money. And with this collaborative, we are now trying to borrow from each other's pockets. So if my eligibility stops here, but I know that Jewish Family Services can pick up that person here, then we do that together and we service the same client. Or it may be that they've got money for rental assistance. We don't have money for rental assistance, but we have monies that qualify for utility assistance. So we'll give the money to the utility assistance to relieve that burden so that they can put it towards their housing. So you're going to see a lot more of that, and I think as a city you're going to have to do that too, where you're looking at more community-based partnerships, and we can't afford to all duplicate services.
I have two questions for you. First is the internship program. Could you tell me a little bit more about the internship program?
It is, at this point, primarily for our MSWs, because to receive your master's degree, you are required to do an internship of a certain length of time within a professional environment. So right now, it's limited to the MSWs, and then with the licensing, because, again, trying to attract the gerontology force, if we can, once you get an MSW, then you still have to do that extra mile to be able to get licensed. And there's an advantage to some who want to be licensed. And that requires a supervision of quite some time. And that means you can't work full-time because you're also getting supervision hours and all of that. So we're doing a program that combines those things, and we have certified professionals who can do that.
Yes. I'm looking more at I'm on the committee for One Future Coachella, and we are working with the health academies in the high schools to introduce children to these professions. So I'm looking more at opportunities for our younger people to be introduced into these professions. Do you have anything like that?
At this point, we don't, and I can say that we haven't been approached to do that at this point. But if that's something, because I don't know who all has, I know that the desert does those particularly, and if that's something that they would be interested in, I'd be very, very happy to take that to our leadership team and say, okay, this is the next step is we've got high school kids that we want to encourage to follow this track.
Can I just chime in? So the health academies and all of the high schools across Riverside County come out of the Riverside County Office of Education. So if you contact them, they would be interested. I am sure.
Okay,
Okay.
great idea.
Yeah.
So
Thank you.
that's 26 school districts.
I would agree with that. I mentor kids at Cathedral City High School, and one of the things that we discuss is the path really to go through a four-year college and incur a lot of debt and then maybe not even get a great paying job. So I think those young people, you know, when they're 16, 17 years old, they're trying to decide their path. So we have discussions. Is that the direction you really want to go? Or maybe you need to learn to code or become a healthcare worker. So I think this is a great way to go, and I hope we can.
Yeah. And my next question is, I am the counselor at the Braille Institute in Rancho Mirage, and when I have an opportunity, if then there's a problem of placing a blind person in rehab or in housing, it is impossible to find a place to place them. What does the Office of Aging do about that? How do you place a blind person in housing or even a halfway home or border care or whatever?
Yeah, two-pronged approach, and again, it would depend on what the specific needs of a client would be. But while we are the Office on Aging and most of our programs are for 60 to 65 and older, we also are service disabled adults. And so we can take in a disabled adult and do case management and have a social worker who will work with them on solutions. And again, talking about the partnerships, we rely heavily on the Housing Authority and working with them to do solutions for hard-to-place seniors. And we've had some luck in doing that. So again, it's pulling whatever community resources we can. Office on Aging certainly can't do everything as a direct service. We don't have the staff and money for it. But our role in the community is to be the ringmaster and bring everybody else together.
There's a program called ACT.
Act One.
Act One. So where is that? Where is the standing of that program in the community?
It's a volunteer organization, or it's a coalition. It's primarily housing at this point, like your smaller board and cares or your larger board and cares. It's professionals in the community, and they meet on a monthly basis, I believe. I currently am not a member because that's the same day I go to my care team meetings. But it is still an active organization. And if you call our office, I can probably get you a contact number for them.
I would like that, please. Okay.
Excellent, Stephen. Thank you for being with us today and preparing your comments. And thank you. Send thanks to everybody in the office. The Riverside County Office of Aging is a great partner in the community, so we appreciate the work that you all do. And hopefully you will be welcome or invite us to tap you again as we progress down the road on this work that we're doing.
Glad to.
Excellent. Thank you.
Thank you.
Next up, we've got items for discussion and vote. First on is the master calendar. Commissioner Sandrasina, do we have any updates on the calendar?
Updates. Not at this moment, as we finished all our parades, right? We only have our neighborhood, our meetings with the Gateway community, which is tomorrow, and that's every other month. And so that's it.
Very good. Subcommittee reports. CDBG Advisory Citizen Committee. I don't have anything. Dale, do you have any updates on that? No. Okay, I think we can take that one off for until next year because our role is finished and it went to council last week and council approved the allocations as suggested by the committee. So we won't address that again until next year. Yep. Okay, community outreach and marketing. Commissioners Sandra Sina, Gross, Morgan, and Randolph. Almost a full house.
We have a meeting after, a subcommittee meeting after this, so we will decide on a few things. Those issues would be table talk. We have a few dates left, and we just need to confirm dates. And once we have those confirmed dates, I know there's some commissioners that are interested in going, so we'll certainly forward those. We're interested in talking about marketing pieces, and we had some ideas. We'll be firming that up and presenting to you at our next full commission meeting. And I want to take an informal survey. Who is on Instagram? Raise your hand. For those of you that are not on Instagram, would you be willing, I would be more than happy to help, assist in just establishing it on your phone? Just a little simple something. The only reason why is because I've been doing a little informal survey via social media. There's a lot of commissions, not just in Palm Springs and other cities, that's the way that they promote themselves. And from the very beginning, and being a part of the marketing outreach committee, we wanted to do things low cost, easy, and can reach the masses. You know, there's some that are very interesting, like the New York City Human Rights Commission. They're very political. They actually legislate. And so to see their post on Twitter, I think they're on a few other sites, but Twitter in particular, they're very hot topic-ish. Ours, of course, would be just a little bit more about just being informal. When we were at the picnic, that was a great way to take pictures. We could have posted that on our own commission site. If we were at one of the table talks, or when you're at one of the other meetings, the community meetings, it'd be a great way for people in Palm Springs just to see what we're doing. And we don't have to be political, we don't have to put too much verbiage up there, but you know, it's a great way to just post a picture. They see what we're doing. Maybe if someone was at the march, they could have posted pictures at the march, because that's certainly a theme for what we're doing. So if you guys would be interested, maybe for the next commission meeting, I'll put it on the agenda for an actual vote to see if everyone would be interested in participating. I don't want to be the only photographer because I'm very limited in my scope of who I represent in Palm Springs, but all of us together, we're in different parts of the community, and I think would be very interested. Certainly one person can be in charge of posting the pictures, but you can send me a picture, you can send me a picture, and it doesn't have to be structured. It can just be Commissioner Chappelle was at such and such meeting, and here's a picture. So we'll talk about that more at the next meeting.
Is that the one where it goes away after a certain amount of time?
No, that's Snapchat. Instagram is also owned by Facebook, full disclosure, and it's primarily just pictures. I thought that maybe if we did Facebook, it might be a little bit more intensive. People can reply more, send more messages via Facebook. It's known more for being more interactive that way. I just thought this would be a good step for us to get our feet wet a little bit and try to promote ourselves, because there is another commission that deals with art here in Palm Springs. They have a pretty nice site, and they actually post a lot of pictures. And I think if they can do it, we can do it. I volunteer, being on the Marketing and Outreach Committee, to post pictures, but I would just ask that we all actually get an Instagram account, not very hard, and we can all take pictures when we're out and about in public, because we're not all at the same functions and meetings. It would be great for the public to see what we're doing.
I'm on the record that I hate social media, but I trust you, David.
What,
so if you want me to have an Instagram account, I'll get one.
May I ask you a question? Do you take pictures?
Yes, I can do that.
Then that's all we'll ask you to do, is take pictures for us. How's that?
Yeah.
But this will be something at the next commission. I'll ask for a full vote if we all would agree to go on Instagram to represent our commission and send pictures, and we can actually have a nice little site.
And
Questions?
before we do that, I'll make some research to see what the city policy is, and particularly with the Public Arts Commission. I think.
Oh, I hope I didn't call them out.
No, it's well known, but there's certain parameters that we would have to follow.
The only thing that I would, if you can find this out, exactly what the parameters are, was the reason for saying something like, doing something with Instagram versus Facebook is, I know that Facebook can be quite political, and I didn't want us to necessarily go that route. Again, starting out with something just to show visibility about what we're doing, different events that we're supporting. So not so much verbiage, just maybe Dale was at the grocery store and he saw this protest, or Denise was at a community meeting, etc.
You might have to get release forms, whoever's in the picture. Sorry. broad.
Okay, next up, student representatives, Vice Chair Chappelle.
Okay, so there has been a committee on that for a bit. It's kind of been our challenge this year to figure out what to do and how to go about doing it. So I had offered to become a part of that the last time that we were together, and Sam, I've been in contact with you too about the ideas. There is an appointment tomorrow at 2 o'clock with Ann Kalasek. She's the Director of Student Services with Palm Springs Unified. I had contacted her, and I think that the concern from the people that I've heard back from, which is virtually everybody on the committee, is that we keep we keep our purpose here, but that we don't just keep it streamlined to a particular student or a particular group. And I can tell you that David's going tomorrow at 2 o'clock. Are you are not attending, Sam? Okay, so David's going to go, and I think that's great. And there's been a discussion about the groups to kind of go to. And once David goes and shares the vision and comes back, I would hope that you would send us an update, if you could, in the next few days, just to see where we have to schedule to try to get those kiddos from various walks. There's been discussion on application process. Find out what is your interest. Are you interested? Do you want to come? So I think that we are off on a good start here, and David will bring it back to us. And I would say that once we have a plan, we can get it going and get those kiddos on there for when we come together and do our planning, because it will probably take a month or so, because there should be an application process. There should be a sit down that we can figure out how that's going to go. And again, there has been a team that we have had in place. I just offered to help.
That's excellent. Good progress, I think. And say thanks to Ann for her willingness at your meeting tomorrow. We appreciate her stepping up to help out.
I will tell you how to get to her after we get done. Yes.
Okay, excellent. That's definitely good progress on that. Thank you. Senior and Dependent Adult Bill of Rights Subcommittee. Some great progress, great news. We'll have Mr. Commissioner Gross share with us an update on the portion that he's tasked with.
Yeah, great cooperation from Mizell. A woman by name who you'll probably meet over the next few weeks by name of Suzanne Spencer on the Mizell staff is working with me to, or kind of the, I guess, point people for really pulling this all together. And so at the end of the day, it's moved relatively quickly in the last 2 to 3 weeks. I didn't have a chance to get this to Dale so we could share this in hard copy, but I will send it to you, Dale. And what I'm looking at here, I'm just going to run through very quickly for you the agencies that have been confirmed for the town hall is what we're calling it. I started to call it a fair, but it's town hall is what we agreed on. Alzheimer Coachella Valley, Dominic Calvano, Desert Insurance Agency, Bill Hartz. I think that is, no, I'm going to ask a question or two on that. I don't want it to be a sales pitch. I do want it to be educational, but I think that's the intent there. But I need to ask a couple of questions. Right from the city, we're going to have, really pleased with this, Lieutenant Frank Browning, who I have the good fortune to know pretty well. And I know that he will do a great job with senior fraud prevention and personal safety. So glad to have him on board. Thanks for the help with getting police on board with us, Ron. I appreciate that. Estate planning, home equity conversion mortgages, Jewish Family Services, Craig Johnson will be with us. Senior Advocates of the Desert, Chris O'Hanlon. Senior Living Options, Leanne Dale. And finally, Veteran Benefits. So that's on the current flyer, and I will start because Suzanne's off on a personal vacation for a couple of weeks, but I will be kind of pitch hitting on both roles, but I will get this out in the next day or two. I'll be sure you get a copy right away, Dale. But and thank you also for your help with the logo. That's really appreciated. So we'll also begin to get this out in social media and other venues as we go. And there may be still some final changes to the lineup here, but the basic message is there. The last thing I will say, though, is, I mean, this ties so perfectly to today's presentation, because the whole idea of the town hall is to begin to also provide some support in some of the areas that we just finished discussing, to help seniors themselves or their caregivers really navigate this whole space. And the idea of the town hall is to have representatives around the edge of the room ready to have those discussions about specific needs. But the other part of the agenda will be, in the morning, will be short, meaning 10 to 15-minute presentations from the agencies you just heard about, to kind of introduce themselves and to encourage people to touch base with them as the day moves along. It'll run from 8:30 to 12 noon at Mizell. It might help if I tell you what the date is. Yeah. Details. Yes, I know. It's so like me to. Monday, May 14th. Breakfast will be served at 8:30. The program will start at 9. And I'm certainly hoping you as commissioners, and for that matter, anybody in the audience that may be hearing this and have interest in being part of the town hall, I'm hoping you will be there. So again, Monday, May 14th, 8:30 for breakfast, 9 per program. I think I covered the territories. Any questions anybody has on where that's moving?
Is there a cost to attend?
No, this is all.
Open to the public?
Yeah, open to the public, sure. I mean, yeah, I don't think we have to be too concerned about somehow screening for eligibility. And fortunately, too, due to the generosity of Mizell, we do have the large auditorium. So I think we'll have pretty good space. I'm thinking we could probably handle at least 100, if not more, but we'll see.
It is intended for the senior population, though.
It isn't, yeah. And their caregivers.
Yeah.
Yeah.
And how is it being advertised, marketed? Mizell's doing all that?
No, well, actually, that's what I'm just saying is I'm going to start the social media aspect of it now. I have the flyer, and I can start to get that moving. The other thing, when Suzanne is back, we've also discussed having coverage from KMIR and what's the CBS affiliate?
SQ.
Yeah, asking them to come and do a couple of little online stories about that. And otherwise, where particularly Mizell will come in is as they are in contact, particularly through the meals program and that kind of a thing, they'll be sure that their clientele already are getting physical copies of these posters. They're 8.5 by 11. They're not big posters, whatever. So they'll begin to see that. The only thing I will share one concern with you because I invite your thinking on this, and it is this. And that is going to be for seniors who may be pretty much bedridden or otherwise pretty much, confined to their rooms. I'm concerned that they physically will not be able to be present for that. And because that's what this is. It's a town hall, and it's pretty much you're there, and that's how it happens. So when Suzanne's back, one of the things I am going to ask about, I have no clue if this is a possibility. And Dale, maybe this is even something you and I could chat about in terms of what the city capabilities might be in terms of having video or mobile video that could capture this and maybe get it up online. So particularly the presentations in the first part of the morning, even for those that cannot physically be there, they can at least partake of those presentations. But I invite other thinking on that, because even having said that, I still think, because I know over the years I've seen them, I've seen the isolated seniors, you know, who haven't left their room in years. And has their family ever visit? No. Do you have any friends? No. No, and no, and no, and those are all no's. And how we touch that segment of the population is going to be a real challenge. So I invite your co-thinking with us on that particular point.
So I wonder if, Dale, when you get the information from Jim, can you see what we can do about getting a press release out through communications? Beautiful.
Yeah.
Okay, excellent. Thank you, Jim. Jim's done a lot of really good work on organizing the town hall, which I have called it the fair also. So in all of my communication, it says fair. Yeah. But yeah, good work on that, and I think it's really shaping up. I would just say that for the role for the commission, I think if you can be there from 8 to noon, that we each be assigned to shadow the presenters, so we can be taking notes on specifically the issues that are being addressed with those seniors that they're talking one-on-one with, because I think that's what the vital information that we're going to need as we start to assemble our report is what are those needs out there. So if we're all able to show up, each one of us can be assigned to a different provider, and we'll just sit with them as they do their table talks and just take notes. Okay. The other side of the work that we're doing on the commission, subcommittee is the reaching out to key stakeholders in the community. So I'm asking that if we have any other commissioners that would like to join the subcommittee, we need a point person who can start the invitation process and invite leaders of key businesses in the community to come to the table, this table probably, and sit with council members Holstage and Coors and a couple of our subcommittee representatives to have a 2-hour roundtable conversation just on the core issues that they see from the corporate business side of things. But we need it's going to take a little bit of time to coordinate that. So if you would like to volunteer for that, just let me know, and I'll give you more information on that. And then next month we'll have Jewish Family Services representatives come and speak to us. And after that, that's going to be May. So then we're in June. We're going to look at possibly having somebody else who works or is exposed to seniors in the community on an ongoing basis, like a postal carrier, somebody else who's engaging with seniors on a regular basis to come. And that will round out our speaker invitations. Then we've got to roll into assembling what is it that we're going to assemble. You know, what is it that we will be putting together for council? Is it just a white paper on a policy suggestion, or are we putting together a Bill of Rights that we will be submitting to the council for their support and input? Okay, and that's it for the Senior Bill of Rights Subcommittee. External. Desert Highland Gateway Estates, Commissioner Sandra Sina.
Yes, so tomorrow is the meeting. David, are we going to be presenting them with the table topics at that meeting?
No, because I have scheduled appointments.
Okay.
I told you that I was available from 5:30 to 4:30 to 6:30. And you
It's
said
at
it
7.
starts
The
at
meeting
7.
is at 7.
I'm available from 4:30
Oh,
to
okay.
6:30.
Okay.
I have a 7 o'clock appointment that I can't cancel.
Okay. So do you want me to do it? I could do a few of them.
We're having a meeting after this, and that's one of the issues that we wanted to actually cover was the last couple table talks. And so we needed to schedule that date. I was not able to go to this one that's actually tomorrow, so that's why I wanted to schedule the last 3 dates so we can finish it up.
Okay.
But if you want to do it yourself, or you want to wait till next month?
We'll talk about it.
Okay.
Okay?
Okay, the Homelessness Task Force, Commissioner Cirillo.
I don't have any updates, Dale. Do you have anything?
There's a meeting scheduled for this coming Thursday. It'll be the Fire Training Center. Those save the dates have gone out. The agenda is going through the approval process, and it'll probably be released tomorrow or Wednesday.
What time is that meeting?
I'm sorry, it would be at 4 o'clock.
I'm not going to be able to be at that meeting, and so I think it's important that the commission be represented there. So I would like to ask if anyone would like to represent the commission there at that meeting. If anyone, and if you'd like to be the permanent commission representative to the Homelessness Task Force, I'm happy to step aside for that as well.
Terry, that's right up your alley. Will you be attending?
I will be there. I don't think it's like in conflict with what I'm doing already there, right? Okay, all right, no problem.
That's fine.
I'm your person.
Very good, excellent. So Terry will now step in to that subcommittee. Very good. Main Street, nothing that was human rights related came up this month. Next up is 1PS. Commissioner Gross, any human rights related issues?
Only this. Most of the story was told earlier, so I'll just simply say 1PS had a very successful picnic in the broad sense of the word, which included us, but also included a very large, well, I don't think it was the biggest turnout ever, but it was a substantial turnout.
It seemed like it could have been the biggest. It was a good crowd.
Yeah, well, of course, the interesting challenge was the first hour and a half was when the march was occurring. And but even then, it seemed to dovetail nicely. I'm glad it did. So I think that's really all that's of any real connection to our commission. But it was. I am glad, in particular, we were there. I think more people are aware of the commission for our being there. We probably do want to think about the little roof thing next year. The sun was our enemy this year, not the wind. But that's a logistic detail. We can handle that, of course, obviously, months down the road. So I think it's all that. Okay.
So could I ask if you could just do a 1 paragraph or 2 paragraph summation of exactly what you just said with the key suggestions on what we need to do for next year, with the pop-up tent being priority on the list, that we cannot do it without that tent. It has to be there. We just can't exchange conversation with people. And year after year, it's going to be sunny. So we just have to plan on that.
Yeah.
Yeah. So if you can do that and then get it to Dale, and then we'll have it in our notes for planning as we approach for next year, and we'll be a step ahead of the game. Beautiful. Last one is the Palm Springs Police Department LGBT Outreach Committee. Whew, long title. We had the town hall with Police Chief Reyes took place last week. Great town hall, really good participation from the community. I think we had 50 plus people, 3 council members, mayor participated. David Reddy was there. So it was really well attended by the city and by community members, and really good dialogue and conversation on specifically LGBT-related concerns and issues with the police department, but community overall issues and concerns. And the best thing that came out of it, or one of the key items that came out of it, was the crime stats that the chief reported at the last city council meeting. He also shared with the town hall. Wonderful reduction in crime statistics really across the board year over year. So we're seeing some great marked improvement, and the chief attributed a lot of that improvement not only to the police department, but to the community and the community collaboration and greater awareness, the connection with the 1PS, the neighborhoods. It's all making a big difference. So good town hall. The next one will be next April. This was the second one that we had sponsored. So the next one, we'll be doing it annually again for 2019. That's it for that. Subcommittee reports. We have new item C, the Human Rights Commission Finance Subcommittee. Nikki's name's not there, but Commissioner Randolph.
Right, I'll volunteer to be that, to manage our huge budget of $2,000 a year. And since Ryan just got here, I did corner him already and say, please consider being on the subcommittee with me. I don't think it'll take more than 2 of us to manage that. But I would like to have input from the rest of the commissioners. So my understanding so far is that perhaps we shouldn't be spending $600 of our $2,000 budget on the Harvey Milk Diversity Breakfast. Not that it's not a worthy place, and I certainly will go if it's not paid for by the commission. So I don't want to, shed any light that that's not important, but it's just too big of a chunk of our budget, I think. So if you disagree, you need to give me that input. Also, I would appreciate input on if we have an extra $600, what should we spend it on? So sounds like a pop-up tent. I think
A new banner.
Well, or at least a pole that's not like drooping in the
We
middle.
we've lost our banner.
Oh, we lost it.
The banner does not droop. You just need to know how to put the poll together correctly. Is that right?
Yes.
Okay.
Yeah.
And I think that there was a pop-up that maybe we can locate that.
Okay, well, and I'll work with Dale on anything that we already have, but
Maybe
I've
it's
seen the marketing box.
With the banner.
And the table cover is quite nice. It's very good quality material. It's got zippers, so it comes down right over the table. And, the logo and the color and everything is very nice. So, but the marketing materials that are in the box are, they're very limited. So it seems that maybe we should work on making new ones and maybe getting them printed. Yeah.
That's what we're talking about.
Yeah. So anyhow, I'm happy to work on that, but I do need input. So you can email me or talk to me after this meeting.
Can I
And I
just
think
get
we
that
should,
started.
maybe the goal should be that you're addressing the budget that we're going to enter into for 19.
Yes, of course.
So that will be a step ahead of the game with the proposed allocation of that $2,000, which I doubt seriously will change at all.
Probably not.
That's a good assumption. So not a dollar more, not a dollar less.
I shouldn't ask for more?
No, we won't get it.
Okay.
So that we're a step ahead of the game. So that's excellent. Thanks for getting a jump on that.
Of course.
Can I just say, I think we talked at one of the meetings about the Harvey Milk, that if we felt that we wanted to contribute the price of the ticket, we're able to. And if those who do not want to, that's fine. But what was the exact price per person?
$65.
So $65 per person, no pressure. But if you want to contribute that amount so we don't take the money from our budget, then that's fine. Per the,
As well as you recall earlier in the year, we were going to start gearing up looking for sponsorships. The Community Service Award, we did receive a sponsorship, so that did offset the increase of the plaques, the cost of the plaques. So those types of things, and I'd be happy to work along with the budget subcommittee to look at that.
And the budget that we have, does that roll over or go away?
It goes away. As you recall, it's general fund.
I had to ask David, I'm sorry.
No. We do that. We do that near the end. We assess what your plan of action for next year, what our marketing materials may be needed. If you do want to look at replacement of some of those items, if you want to look at professionally printing some of the materials, so those will be the types of things that the finance subcommittee we can dive into and kind of get an idea. So the budget goes till June 30th. As long as the funds are committed, they're expended. And we rolled over 2 pennies last year, I think. So we're very good in making sure our resources are utilized.
Well, I was unaware that we could get sponsorships. I did have that job for about 22 years in radio. So I'd love to approach that, but then that means we have to spend the money on professional marketing pieces. You can't sell a sponsorship and then have a Xerox copy. Okay, great.
even though they are very nice Xerox copies, though, because they come from your office, so it's very nice and very professional, but maybe just a little bit more color, I guess, right? Is that what you were saying?
Yeah. Well, I do have one additional question, though, which ties, I realize the basic, I'm quite aware of the general financial environment of the city and the challenges overall the city's facing. So I get the comment that likely the 2,000 is probably the best that can be done. At the same time, Dale, I'm kind of looking at you, but I'm also kind of looking at Nikki. Do you think it is a worthwhile You see, where my head goes is if we could do what I used to call my business world, a zero-based budget, which is rather than being driven by how it was in the past, but really what do we need in the present and the near future.
Yeah, I think that's a great suggestion. We've got Commissioner Randolph. You lead the way. So
Yeah,
you
and-
bring it to the table, tell us what it's going to be. Yeah.
But bring it to but here's where I'm kind of looking at Dale, is if we go down that route, do you think there's a way to, because I know council's going into the budget process themselves right now. So is there a way to provide, if there were such input, and maybe it's going to be another year before we are ready for that, but is that a process we could begin to kind of look at as opposed to just simply have a budget line that repeats year after year after year after year without looking at what are the needs? You see where I'm coming from?
I hear what you're coming from,
Yeah.
but we are at the budget process
Right.
at this time, so we may be late in the game. But in terms of budgeting for future years,
That's kind of where my,
we can begin in that direction, and it would give us a longer lead time to
Right.
get it into the process. There's also, too, I mean, just within your commission, there are members that have made contributions to the commission, and those funds are in addition to what the city allocates. So there may be some creative ways that we can seek out some resources that would supplement what you receive from the city.
okay.
If we're getting donations for the commission, can we have a list that we can write a thank you note for these people? I mean, I love writing thank you notes. I think it's a nice little touch just to say thank you if someone's so kind as to donate monies to the commission.
It is a formal process. The director of development for the city does receive those gifts, those donations, and thank you notes are written.
Oh.
There's no other, public recognition. I think when we talked about formatting this year's Community Service Award, we even thought of a program, a little more bio about the awardees, maybe some congratulatory ads, things of that nature we can pursue further along.
Okay, excellent, thank you. Item D, topical newsworthy items. We can go around the table. Anything new to bring to the table?
I don't have anything, but I am happy to see that we have two commissioners on board with us. We've got these great pink shirts that Ron loves his pink shirt that we can tell you how to get. So the first time we'll get together and have to carry the invisible banner, you'll have on your pink shirt if you want to.
Okay. I sent out an email today for the Elder Dependent Adult Symposium put on by the CARE, and I would like, I do get tickets for it, but I would like Dale to find out if the other commissioners can go for this. It's a wonderful opportunity for us to see exactly what happens with our elder population.
So I think maybe you follow up with our finance budget chair and address that topic from a budgeting standpoint.
There is a charge to attend?
I get tickets, 2 tickets, but so probably the Human Rights Commission may get tickets if.
Well, I did receive that this morning. I did a search, and even within that organization, there is no information about the event. There is no agenda, no itinerary, no speakers. It may be a little premature until we know the contents of the program. I'm certain professionally it relates well to your position, but not knowing the content of the event, we would hold judgment to see if the budget could even afford it.
Okay. And the next one I want to talk about is I've got a spreadsheet of all the organizations that are in the Coachella Valley working with our disconnected youth and all the other services and also our elder populations. So I would like to sit with David and put some flyers together for our next year's a picnic, because this is, this is the latest information on and numbers for community.
Oh, excellent.
Okay?
Mhm.
So I have it. I'll work with David on that. That's it.
Topical newsworthy items.
Oh, no, nothing. Thank you.
I have one question for Dale, and I have one comment to make from a personal experience. My question for you, Dale, is can you give us an update on what's going on with affordable housing? We had some conversation. The city had 3.5 acres, and that seems to be moving along, and that certainly seems like it's one of our issues, is affordable housing. I know we're talking about homelessness, but affordable housing is looming as well. I just don't want to see what happened in San Francisco, where only the rich can live in the city and working people can't afford it. So I'm very curious if you could give us an update on what's going on with that. Oh, Jay.
Thank you. On that particular parcel, the city and the Housing Successor Agency, whose funds purchased it, have a live proposal from a group called Community Housing Opportunities Corporation, and we're in the drafting of the exclusive negotiation phase, an ENA. So we can definitely report back on that as that moves along, not a problem. But so far, it's going pretty smooth. Now, my understanding is the site had not been successful for 2 past attempts, so we're crossing our fingers to see how smoothly the process goes this time.
Do we have a anticipated number of units, number one, and number two, when would it be complete if things go according to plan?
The schedule hasn't been laid out yet, but the site can accommodate 53 units, not including state density bonus. So with that calculated in there, that could be anything from 10 to 20% additional units. Given the site can accommodate height-wise and parking-wise all the other demands. So timing-wise, I think once we get into the exclusive negotiation agreement, which is anticipated to be about 180 days, then the next step would be to move into the disposition and development agreement for that project. Hopefully at that point, through a successful ENA, all the other pieces are in place, and it's just a matter of executing the development agreement, getting the entitlements, and that will typically takes about 18 months to 24 months. The affordability hasn't been determined yet, but definitely affordable. The mix of affordability, we do not yet know.
And the other comment I just wanted to make, and it's towards our speaker today, when he was talking about those people who are caught in the middle. They don't qualify for the low-end services, yet they don't have enough money to meet their needs. My household got caught up in, this has to do with health insurance, but caught up in that spin. So over the last week, we've experienced that where, you don't make enough money here to have covered California, and we're sending you to Medi-Cal. You go to Medi-Cal. Well, you make too much money, and then they cancel the covered California insurance. Now you're sitting there for a whole week with no insurance. And this is a household where, the person who's getting screwed is an attorney and can't get through and get it. It got solved this morning, but I really feel for those people, because if I can't figure it out, if we can't figure it out, and it's happening to us, something's wrong with the bureaucracy. I mean, I don't know if they, the government, whoever set up these rules, they didn't anticipate for all people. everything's based on household income. Well, what's a household? You know, we are together for 20 years, but we're not legally married. And so it's just really confusing and unfair and wrong, and they are not capable of figuring it all out. It's a very frustrating experience. So just wanted to share that.
And I think that it is important to say that it isn't only happening to you. So don't feel alone. I am up against it. But I will tell you that the services that are there in place, that these people are to be paying for their care, who have people like social workers who are supposed to help them while we're trying to get them to wherever they have to be. They aren't getting any help, and I have said in these past couple of weeks that I do understand how that elderly person is without a home. So the thing that I wanted to talk about, but I wasn't sure, I do think that there is a strong service for the people in between and for the people at the bottom, because even if they are getting care, they can be basically taken out the back door, and these people who are being paid to serve and to be of service aren't doing it. So unfortunately, you have to figure out how to get them from point A to point B. So if there is a way to get into hospitals and into these care facilities with the people who come and talk to us, to talk to the people that people aren't talking to, I do think that that is a piece to help us with all of these people who we're talking about, who are in crisis that can't get help.
Well, one of the reasons I brought up earlier the whole guardianship thing, and I didn't want to take the time to pursue it right then, but he only responded from the standpoint of guardians from an institutional standpoint. What's really making me nuts, and I have been a conservator for my father, was a family thing, but gave me the opportunity to first see, and now I will send a story to you, Dale, you can circulate from the New York Times on guardian abuse of seniors. We're talking about, with court permission, full legal rights of the guardian to come in with no notice and remove people from their homes, sell the home, put them back in a cheaper facility, and they pocket the difference. And there's a group of guardians in Las Vegas, fortunately, who are going to go to jail at this point, but it took almost 5 years. And I observed that system at work, and while I feel comfortable personally with my father, I could see a zillion loopholes, and I'm aware from my family's attorney where they have been abused. This is an hugely underreported thing. So I could get winded up in this and go for hours and hours. But there's a whole nother aspect to this which is really chilling. And so I'm hoping we take that into consideration, this whole public guardianship, and is it being appropriately attended to? Because it is not. And I don't mind saying that non-categorically, because it's not. Anyway.
Commissioner Michio. Commissioner Morgan.
Pass.
Pass. Commissioner Andrade. All right, Dale, you have anything? Jay?
Well,
You were speaking of the city budget. April 24th, Tuesday, April 24th, the council will have an ad hoc budget subcommittee meeting, town hall, at 9 p.m. at the council chambers. So if you have some desires, wishes, suggestions, you could have your opportunity at that time. Also, too, the council will do their second informal community forum, a community conversation, May 1st, Tuesday, May 1st, it's 5:30 to 7:30 at the Palm Springs Convention Center. The topics are wide and broad. Most recently, the potential new voting districts in the city could be for discussion, proposed parks, other interests. The new sales tax has gone into effect, maybe some insights of how those funds could be used, but probably stand in line. But May 1st, Tuesday, May 1st, it's an informal community forum, 5:30 to 7:30 at the Convention Center.
I think that's a two-sided.
Yeah, it's on both sides. Yeah, that's what David was saying. I was kind of cheap. I didn't say that.
It's internal, it's okay.
All right, very good. Thank you for that. The only item I have is I just would like to get a straw poll on, is there support for the commission to recognize the student organizers of the March for Our Lives? If there is, then we'll move forward to try to get that organized before the school year is out, which doesn't give us a lot of time, but we will work on that. Dale and I will. Okay, agenda items for the next meeting. Commissioner Randolph had one.
Yes, so the gentleman that was speaking about, I don't think he was particularly clear, but basically what I got from them was that there are no non-smoking rules in the city of Palm Springs, like at bars and restaurants, like you can be outside and you can smoke. And that's an odd thing to me. It's like, really, there's no rules about that? But evidently they're not. And as he pointed out, we're kind of behind. It's a health hazard, and, the youth are being, I mean, the tobacco industry is, it's well known that that's who they target to keep it going. Now we have the wonderful vaping going on. So I'd like to see that put on the agenda to discuss if we want to support those gentlemen as they ask for us to give a letter. Let's just have a discussion. Can we have that on the agenda for next month?
It can be on the agenda, but before they excuse themselves, they have a prior commitment next month. They would not be able to join us. They're available for the June meeting, so we can do some research or get some materials together. I can see what they presented to the Sustainability Commission and see if just have some general information for your reading and then have some action item for the June meeting.
Okay, I propose we put it on the June agenda to discuss the smoking regulations in Palm Springs.
Any other agenda items?
Social media.
I got Instagram. And
then I have one is to address the changing our meeting time from 3 o'clock to 5 o'clock. And I think we just covered announcements. There are no other announcements, Dale? Okay.
And can I just interrupt? I'm sorry. I think that is probably something that will have to be discussed with the potential student applications if we do that. They definitely do have evening activities at schools, but it's definitely a piece to put out there as a possibility. Would that be okay for David to share that the times could be changing tomorrow in your process?
Yeah, I would definitely share it because I think
it's not done,
we're
but
going to be
it's a
shifting that
possibility.
direction. But also, I think the reason why it's on next month is it's a perfect time for us to do it because we don't have a student, and we can try it for a couple months through the summer and see what type of response we get. Is there any more participation from the community or not?
Mm-hmm.
And then by the time we get a student on again, we can come back and reevaluate. So we'll be able to dig into
So-
that a little deeper. Dale's gonna,
I would share that, and again, they have lots of evening activities, so that's just gonna probably lend itself to a person who really wants to participate.
okay. If nothing else, we will adjourn at 4:42 to an adjourned regular meeting Monday, May 14th, 2018 at 3 p.m. here in the large conference room at City Hall. Thank you all.